Well, good evening, everyone, and thank you for joining us this evening. Tonight is a wonderful collaboration with USC Norris Cancer Center and Celebrate Life Cancer Ministry. Uh-oh, hold on. Okay, who can't find the mute button? Um, there we go. All right. So again, welcome everyone. We are going to share a presentation tonight. Our presenter is Ugana. She'll say it better for you. A new friend of mine, and she is a PhD student at the University of Southern California. She has been a clinical research coordinator, data manager, and cancer researcher over the last 10 years. And we're going to turn this evening over to her. Thank you so much, Ugana. And oh, I'm sorry, we also want to thank our USC team who is visible to me right now, who is Dr. Giuseppe Lopez, Priscilla Marin, and Bianca. All righty, so all in your hands.
All right, so I'm going to share my screen here to get this presentation started. And let's do this. Is everybody able to see my screen okay? Okay. I saw some nods, so okay. So hello, my name is Ugona Hinacho, and thank you for joining us for this presentation. And actually, let me just hide a few more things because I still have some pop-ups showing up. Okay, sorry about that. Let's get started over again. So like I said, my name is Ugona. Thank you for joining us for this presentation titled Breast Cancer and Smoking, Understanding the Risk, Research, and How You Can Help Your Community. To tell you a little bit about myself, I'm a doctoral student at the University of Southern California in the Department of Preventive Medicine. And I am a cancer researcher. I'm writing my dissertation on the effects of smoking on hormone levels and breast cancer risk among young women. So just a disclaimer before we start, I am not a physician, and the information provided is no substitute for professional medical advice. If you have any questions about your care or your diagnosis, please follow up with your primary doctor or oncologist. So I want to start with a quick introduction to breast cancer. I do acknowledge that men can also be diagnosed with breast cancer, but in this presentation, I will only talk about breast cancer among women. In general, breast cancer is a cancer that starts in the ducts, lobules, or connective tissues of the breast. The lobules are the glands that produce milk, and the ducts are the tubes that carry the milk to the nipple. Most breast cancers begin in the ducts or lobules. Breast cancer is the most commonly diagnosed cancer among women in the US, and during their lifetime, about 1 in 8 women will be diagnosed with breast cancer. Although it's generally understood that breast cancer is the most common cancer, I think that putting it on a graph helps us to see exactly how common it really is. So this is a list of the 10 most common cancers among women in the United States in 2018. This is the age standardized incidence rate. And so age standardized basically means that these estimates already account for differences in cancer risk by age. And then the term incidence means that this is the rate of newly diagnosed breast cancers. So this graph shows that in 2018, about 84 women out of every 100,000 women were newly diagnosed with breast cancer. And as you can see, that's even more than twice the amount as the second most common cancer, which is lung cancer. There are many different types of breast cancer. So when cancer is diagnosed, it's often described by its characteristics so that physicians can develop an appropriate treatment plan. Breast cancers are always characterized by these 3 terms. And so in situ means that the cancer has not spread. These last 4 years. It is not an exaggeration.
We've lost the speaker. She's on mute.
I think because
Is it back on now? Can everybody hear me okay? Okay, thank you. So starting back, I'll start back at the beginning of the slide. There are many different types of breast cancer. So when breast cancer is diagnosed, it's often described by its characteristics so that physicians can develop a treatment plan. Breast cancers are always characterized by these three terms. And so in situ means that the cancer has not spread to other breast tissue. Invasive cancers are cancers that have spread to the other tissue in the breast. And metastatic cancers have spread beyond the breast tissue to other tissues in the body. Breast cancers may be described as ductal or lobular, which specifies where the cancer started. So for example, a ductal carcinoma in situ means that the cancer, which is a carcinoma, started in and is still contained in the milk duct. There are a few other types and other terms for less common types of cancers. But another way that breast cancer is often described is by the molecular subtype. The majority of cancers are the luminal A molecular subtype, but there are also luminal B subtypes, the HER2 type, and triple negative breast cancers. These subtypes are identified by a few factors, including the estrogen and progesterone receptor status and the HER2 receptor status. Characterizing the molecular subtype is important because if the cancer has any of these hormones or protein markers, for example, like in the cell here, the physician may decide to prescribe chemotherapy or a drug to block those receptors, which would then keeps the cancer cell from growing. So now that we've talked about the basics of breast cancer, let's talk about what can lead to someone being diagnosed with breast cancer. Let's talk about cancer research. The field of cancer research is also called cancer epidemiology, which is a term to specify that it's the study of the patterns and risk factors and health-related events like death and disease in human populations. In research, we rarely talk about what causes a disease. The cause of a disease is typically something that's decided on an individual basis, like if it can be determined, it's based on individual factors. So in research, since we're using information from a group of people, instead we talk about what is associated with disease and how likely it is to have the disease if you have these exposures compared to someone without that exposure. We do this because, as you all know, there are stories of people that have smoked their whole life and never had lung cancer. So as I discuss factors in breast cancer, I'll talk about the risk factors and how likely it is instead of talking about definite causes. Breast cancer is an age of disease. As you see on this graph, women between the ages of 60 and 70 years have the highest incidence. And incidence, like I said earlier, is the rate of newly diagnosed breast cancer. However, below the age of 40, Black women have a slightly higher rate of breast cancer. As you can see, the red line is a little bit above the other lines here. Furthermore, mortality is the rate at which people die with the disease. And as you can see here, the rate increases with increasing age. As I am personally interested in cancer disparities research, I want to point out a disparity that exists in breast cancer using these graphs. So although Black women are less likely to be diagnosed with a new case of breast cancer after the age of 40, we see here that compared to white women and women of other races, Black women at all ages have the highest risk of breast cancer mortality. So they're most likely to die with breast cancer than women of any other racial ethnic group. There are some differences in lifestyle, environment, and genetics that contribute to differences in being diagnosed with breast cancer, and there are additional factors in breast cancer type and breast cancer care that contribute to differences in dying with breast cancer. And really, there's a lot that we can unpack and discuss about like what's going on between these two graphs. But let's go ahead and continue on with discussion of some of the risk factors and things that can contribute to having a breast cancer diagnosis. So over the years, a number of studies have been conducted to identify risk factors associated with breast cancer. A few of the factors that have been identified as non-modifiable or things that cannot be changed are listed here. For example, you're more likely to be diagnosed with breast cancer if you're female and if you're older, which are things that I've already mentioned in this presentation. But some non-modifiable factors can be changed if addressed ahead of time or on time. For example, with parity in breastfeeding, parity, it refers to the number of children a woman has given birth to. So not giving birth to a child or having your first child after the age of 35 are factors that are associated with an increased risk of breast cancer. Also with DES exposure, DES was a drug that was given to pregnant women to prevent miscarriages until the early 1970s. It's non-modifiable because once you're given the drug, you can't change that risk. But if you know about the risk ahead of time, and DES isn't prescribed anymore, but these are things, if you know about the risk ahead of time, for example, with radiation to the chest, you may consider if it's necessary, but you'll always make those decisions with the advisement of your physician in terms of radiation to the chest. So understanding the non-modifiable risk factors is important because if you know that you have an increased risk of breast cancer, let's say you have a family history of breast cancer or you carry the BRCA gene, you may want to pay more attention to the modifiable risk factors. The modifiable risk factors are what health professionals will often focus on because these are the conditions that patients can control or alter to reduce their risk. For example, high alcohol consumption and use of oral contraceptives can increase your risk of breast cancer, but increased physical activity and eating a diet full of fruits and veggies can reduce your risk. Some risk factors have been identified with conflicting results and are under further evaluation. For example, there are an increasing number of studies that suggest that stress and racial discrimination or racism are associated with breast cancer risk. And also, I recently read a study about night shift work and ambient light exposure at night and how they can disrupt melatonin levels, which could then change your hormone levels and put you at an increased risk of breast cancer. But more work is being conducted to understand these. Tobacco exposure, which is the focus of this talk, is still considered to be under evaluation, but an increasing number of studies are suggesting a consistent association with increased breast cancer risk. I will discuss some of those studies later on in this presentation. So I use this image to show that, this image here, to show that although many of the risk factors are similar for breast cancers diagnosed over and under the age of 50, there are certain factors that can contribute to the differences in breast cancer risk by age. Some studies have been developed to describe risk factors that are common among women with early onset breast cancer, or that is breast cancer that's diagnosed among women under the age of 50. Women diagnosed under the age of 50 are mostly premenopausal, and women over the age of 50 are mostly postmenopausal. So in some studies, if it's not conducted by age, they may have been conducted by menopausal status. As we see here, women diagnosed under the age of 50 are more likely to be Black, especially if they're diagnosed before the age of 40. But if they had an older age at menarche, which is the onset of their period in adolescence, they were less likely to develop breast cancer before the age of 50. On this side, we see that women diagnosed with breast cancer over the age of 50 are more likely to be white, obese, and have high alcohol consumption. Giving birth to many children or high parity is associated with a decreased risk of breast cancer. So smoking is a risk factor that was recently suggested to be more strongly associated with breast cancer among women under the age of 50, but that's under further evaluation. So you're likely here today because you want to know what information exists about smoking and breast cancer. So let's talk about it. But first, let's talk about smoking alone. When evaluating the effects of smoking on breast cancer, it's also important to consider how the differences in smoking behaviors in the population can contribute to these differences that we're seeing in the studies when it comes to differences in breast cancer by smoking patterns. According to a report by the Centers for Disease Control and Prevention, smoking behaviors differ by race, with a lower prevalence of smoking among Black adolescents and young adults, and more Black smokers initiating at a later age compared to white smokers. Also, studies have found that Black smokers metabolize nicotine at a slower rate, and this factor has been associated with poor health outcomes. So furthermore, Black children and adults, but in this case, especially Black women, are more likely to be exposed to secondhand smoke than women and children of any other racial ethnic group. Beyond race, smoking behaviors also differ by socioeconomic position. Socioeconomic position is similar to a term you may be more familiar with, socioeconomic status, but SEP can incorporate more information about a person's social history as well as their financial status to describe them. As a proxy for low socioeconomic position, a study found that adults that did not complete high school were 3 times as likely to smoke as adults with a bachelor's degree. Also, adults with a high school diploma or less often smoked twice as long as smokers with at least a bachelor's degree. So this means that low education, which they used as a proxy for SEP, was associated with more smoking and smoking a longer time before quitting. However, using SEP alone could be a better descriptor of a person's financial status. So here I also describe some information by socioeconomic position. So the prevalence of smoking among adults living under the poverty level is twice that of people living at or above the poverty level, as we see 38.1% compared to 13.9% here. Also, adults of low SEP tend to smoke more heavily, which means they tend to smoke more cigarettes per day. Also, secondhand smoke exposure is higher among people of low socioeconomic position because they may be more likely to be service workers and blue-collar workers that experience secondhand smoke exposure at work. So now let's talk about some recent studies that describe the association between smoking exposures at various times in life and breast cancer risk. Let's talk about the research. I am going to discuss what the research says about secondhand exposures and personal exposures throughout the life course. So we'll talk about some secondhand exposures in the prenatal period and in childhood, as well as some personal exposures in adolescence and adulthood. Starting with prenatal exposures, in the Sisters Health Study, they evaluated the association between smoking and breast cancer at certain periods of susceptibility. And so one of the assessments was prenatal exposure, which is were they exposed in utero when their mother was pregnant with them? They found a 6% increased risk of breast cancer among women whose mother smoked while pregnant with the participant. But that number doesn't have an asterisk here, and I have a note that says the asterisk means that it was significantly different from women that were not exposed. But in this case, they did find a slightly higher increased risk, but it wasn't different from women whose mothers did not smoke during pregnancy. However, the sister study also evaluated early exposure to secondhand smoke, and in that case, they did have significant findings. They found that women whose mothers were exposed to household secondhand smoke while pregnant with them, were 16% more likely to be diagnosed with breast cancer. Also, in childhood, they found that 18 years of secondhand smoke exposure was associated with a 17% increased risk of breast cancer. 16% and 17% may not seem like very large numbers, but these numbers mean that out of a group of 6 women, if we had a group of 6 women with either of these exposures, 1 out of those 6 would be likely to be diagnosed with breast cancer. In regard to early smoking behaviors, the Sister Study and Nurses Health Study evaluated if smoking initiation in adolescence was associated with breast cancer, but neither found a significant association. Both studies also considered smoking initiation in respect to another breast cancer risk factor, which is the age at first full-term pregnancy. And so although both studies identified about a 20% increased risk of breast cancer, the Nurses Health Study found a significant difference in risk among women that started smoking between their first period and first live birth compared to women that did not smoke. Here it says per 20 pack year increase, and pack years is the measure of the average number of cigarettes smoked per day per year. So that note that it's per 20 pack year increase means that if someone started smoking before their first pregnancy and smoked on the average 40 cigarettes per day, or like twice that 20 pack year measure that they gave here, then they would be at a 36% increased risk of breast cancer compared to non-smokers, because it will increase in multiples of 20 pack years. And so furthermore, the California Teacher Study and the Nurses Health Study both identified a significantly increased risk of breast cancer among current and ever smokers. Although each of these studies were pretty large and very well designed, their applications to the general population has some limitations. The Nurses Health Study and the California Teacher Study are made up of really highly educated professional populations. All three of the studies were made up of mostly white participants. Therefore, it's important to conduct these studies in populations of racially and socioeconomically diverse participants to confirm and expand these findings. So the last slide discusses a lot about how smoking can contribute to a new diagnosis of breast cancer, but you may be asking yourself, well, I've already had breast cancer, so could smoking still affect me? The short answer to that is yes. So let's talk about how smoking can affect breast cancer survivors. Here we see the results of a study of more than 9,000 breast cancer survivors. They asked women for their smoking status 2 years after their initial breast cancer diagnosis, and then their medical records were checked for their long-term cancer outcomes. First, they assessed breast cancer recurrence, which means that the participant was declared to be cancer-free and in remission, but then had a new diagnosis of breast cancer later on. Compared to never smokers, we see we have these four categories of smoking, these four smoking categories. We have former smokers with less than 20 pack years of smoking exposure. We have former smokers with 20 to 34.9 pack years of exposure, former smokers with more than 35 years pack years of smoking, and we have current smokers. We see that women that had formerly smoked and smoked less than 20 pack years had a very low risk of breast cancer recurrence compared to non-smokers. But we see that participants with 20 to 34.9 pack years of smoking had about a 20% increased risk of breast cancer recurrence. Former smokers with more than 35 pack years of smoking and current smokers had a pretty similar risk at about 40% increased risk of breast cancer recurrence. The other outcomes were breast cancer mortality and all-cause mortality. Breast cancer mortality refers to the participant dying because of a factor related to their cancer or cancer treatment. And all-cause mortality, this is death from any cause. So all-cause mortality does include breast cancer mortality, but it may also include things like a woman that survived cancer but then died in a car accident or died of natural causes at an old age. So it's any cause. We make this distinction between cancer-specific and all-cause mortality because sometimes we're interested in learning if you have increased mortality because of the cancer or cancer treatment. And as you know, smoking is associated with cardiovascular disease and other cancers that may contribute to death. So okay, as everybody will. So breast cancer mortality and all-cause mortality are evaluated because as we know, especially in the case of smoking, we know that smoking is associated with cardiovascular disease and other cancers that may contribute to death. So by evaluating the all-cause mortality, we can compare the two and even compare it to existing research to see if we see what we would expect to find. So in the study, they found again that less than 20 pack years of smoking was associated with a very small increased risk of mortality for both breast cancer mortality and all-cause mortality. But they did also find that smoking more than 50 pack years of more than 35 pack years or being a current smoker was associated with almost 60% increased risk of breast cancer mortality. And furthermore, here we see that with all-cause mortality, current smokers were had rates that were more than twice that of non-smokers for all-cause mortality. Although we see the increased risk of recurrence and mortality with smoking in this population, it's also important to, an important takeaway from this chart is that even if you did smoke, if you were a former smoker that smoked for less than 20 pack years, so you smoked but you quit pretty early on, then your risk of adverse health outcomes could be closer to non-smokers compared to people that had smoked for longer periods. So the research on secondhand smoke exposure had conflicting results. There were some difficulties in measuring secondhand smoke exposure because to be thorough, you need to consider exposure in childhood and adulthood and at home and at work. But also after cancer diagnosis, people often make drastic changes to their lifestyle. So there isn't consistent information on breast cancer recurrence in secondhand smoke. However, I did find a study that described that recent exposure of a secondhand smoke in a recent exposure of 10 hours per week or more it nearly doubles your breast cancer mortality and all-cause mortality among breast cancer survivors. There was no association observed among women that were formerly exposed to secondhand smoke in the study. So in general, the study is saying that if you are still undergoing your treatment or you're a breast cancer survivor and you're exposed to 10 or more hours of people smoking in your presence, that exposure may be putting you at an increased risk of passing from a complication of your breast cancer or contributing to an early demise. So to continue on, now that we've talked about breast cancer, smoking, and the studies on smoking and breast cancer, let's talk about what you can do to decrease your risk if you do not have breast cancer, or what you can do to improve the quality and longevity of your life if you are someone that is overcoming or has already survived your breast cancer diagnosis. First, talk about breast cancer screening. The recommendations for self-examinations have changed. It used to be recommended that you do self-exams every month, but now the recommendation is that you do at-home breast cancer screenings to be familiar with your breasts and so that you can notice any changes if and when they do come. I thought that this was a really great image of what changes you want to pay attention to. You want to be familiar with your breasts so that you could know your lemons. If you're experiencing any of these changes, you can bring them up to your physician and then they can advise you further on if you need to come in for a mammogram or any other clinical screening for breast cancer. The image on this website is available at knowyourlemons.com if you want to check that out and learn more. Since a self-examination is important for noticing changes, it's good to talk to your friends and family and ask them, are you comfortable with your breasts? Like, would you notice if you had any changes? What can you do to be more familiar with your breasts so that you can notice any changes if you have them in the future? Also, when you go in for your annual visits with your physicians, that's another opportunity for breast cancer screening. Breast exams are still a part of routine care for gynecologic visits. And even if you go in and it's not performed, just ask your physician. Say, hey, I just want to make sure that there's nothing weird going on. Would you mind performing a screening for me? And otherwise, just make sure that you're going in for your mammograms as recommended. The recommendations vary by age, by your family history, and by your personal or medical history. So I didn't put any of the recommendations here, but please check in with your physician to make sure that you're following up on the appropriate schedule for you for starting or continuing your mammograms. Encourage your friends or family also when it comes to things about doing these screenings. For example, some things are more easily done or more enjoyable if you do them in pairs or groups. So maybe have a discussion with some close friends or family about going in for screening. You could even all schedule them in the same week or in the same month so that afterward you can talk about it and share your experience with each other. As the title says, talk about it, but I don't only mean to talk about it with your provider or with professionals. I also mean to talk about it with your support system and engage your family and friends in these life-saving changes so that you're making for yourself and hopefully that they'll make for themselves. Talk about quitting smoking. Quitting smoking or smoking cessation is not easy, but it has some very clear benefits, and those benefits can be seen in as little as 48 hours after quitting. This is a nice flyer that I found on the University of Utah's website. It has the link below, and these slides will be shared with each of you after this presentation. So I've included the link so that you can find that if you're interested, in case you want to print it and share it with other people in your circle. A lot of people struggle with quitting smoking, but there are many ways to do it successfully. Sometimes it's important to understand the timing of your cravings, like when and why you have the cravings that you have. You may also need to use a smoking cessation product, which could be an over-the-counter product like nicotine gum or patches, or it could be prescription cessation products like nasal sprays and pills. There are also smoking cessation programs and support groups. Right now, there are more and more options that are becoming available online. For example, the CDC, the American Cancer Association, and the American Lung Association all have online cessation programs. So there are resources online and there are support groups available in general. But also there's social support. So this could be from your own friends and family. You can talk to them and ask them for support by letting them know, hey, I'm trying to smoke. Please don't smoke around me. Or I'm trying to smoke. Can you help me? Can you check in on me and just support me? Just ask for what you need from your support systems. Outside of that, if you need some support outside of your regular networks, you can also contact a quit line. 1-800-QUIT now is a number that you can call to contact a quit coach, who's a person that's trained. Sometimes it's a former smoker, and they're trained to listen to you and to offer you encouragement and offer you helpful tips about kicking your habit. The American Cancer Society also has a number that you can call to get help with quitting. So both of those numbers are given here. For secondhand smoke, it's recommended that you prohibit smoking in indoors and in all enclosed spaces. For example, don't let people smoke in your car. Furthermore, let's talk about making lifestyle changes. Earlier, we went over the list of modifiable factors, and many of those are what you'll find listed here. The recommendation is to achieve or to try to get a healthy weight. If you're already at healthy weight, you want to maintain that weight. You also want to stay active and maintain a healthy level of physical activity. I have this flyer here, and it specifies that we should aim for about 150 minutes of moderate intensity physical activity a week. That's about 30 minutes of moderate physical activity, something that gets your heart rate pumping and where you're breathing a little more heavily 5 days a week. I know that this is always easier said than done, so I like to tell my friends and family to make it fun for yourself. For example, my mom tries to stay active and she goes for walks as often as possible, but she often walks at a slow and easy pace. So she's not always getting up to a moderate level of physical activity. So one day I showed her how to find workouts on YouTube, and I showed her a Zumba page, which she loved. But also she took it even further. And the next time that I went home, she showed me an Afrobeats workout page, and she asked me to do it with her. So we did the workout. We were both dripping sweat at the end, and now she's getting in more minutes of moderate and vigorous physical activity again. So I also, since then, I try to encourage her to keep it up. I'll call her if I tried a new dance workout and I really liked it, and I encourage her to keep doing it so that she can really make it a part of her normal routine. You can also try to adopt some other lifestyle changes with a healthier diet of fruits and vegetables. Lots of fruits and vegetables reduce your breast cancer risk. And furthermore, there's a compound called carotenoids that are in orange and yellow fruits and vegetables like carrots and cantaloupe. And they're also found to be protective and help to reduce your risk of breast cancer. Last, reducing your alcohol consumption is really important. As the flyer says here, you should try to restrict it to less than 1 drink per day. So all of these factors can help reduce your risk of breast cancer, but many of them are also found to improve breast cancer survival among women that have already been diagnosed with breast cancer. So please consider talking to your friends and family, partner with them about these changes, encourage them, encourage each other, keep each other accountable, and in whatever way you can, make it fun so that you can really achieve and maintain healthier habits. Last, I want to talk to you about participating in clinical research trials. There is an urgent need for more diversity in clinical research, and this is diversity in lifestyle as well as racial ethnic diversity. Clinical research tends to be conducted in a pretty uniform group of affluent and white people because a part of this is because they may be people that have jobs that offer sick time, so they're able to take the extra time at their doctor's office for a study visit, or they have better health care and therefore have more access to more opportunities for clinical research. So in general, they're more able and willing to take the extra time out of their daily life to participate in clinical research. As mentioned before, the Nurses' Health Study and the California Teacher Study were conducted among nurses and teachers. So these were studies among educated professional women and mostly white populations. So their lifestyle and their factors and their exposures may not be a good representation of someone with a low socioeconomic position. And although this presentation is about breast cancer, it's important to know that outside of breast cancer research and research of the reproductive organs, women often do not participate in clinical research in high numbers. And I know that especially in the Black and Latino communities, there is a lot of mistrust of clinical trials because of the Tuskegee syphilis study and forced sterilization among immigrant women. But things have changed and there are more protections now. So when you're considering participating in clinical research, talk to your family about it. Let them know that you're considering getting involved, and let them know what you're considering getting involved with. Let them look it up, and as well, you can look it up so that you can know what you're participating in. When you're talking to the physicians and they approach you about clinical research, they will offer you some information, but you should always ask questions. Ask them every question you have. The researchers and their staff are here to answer every single question. So there's no such thing as too many questions in clinical research. And I say that because it's really important that you know what the trial will require of you before you start, because they need to get complete and accurate data from you, and they want you to be able to complete the study. And so they want you to be well informed and to be willing to carry it through. The information they use from the study will help them to identify how well their procedure or their drug will work for other people. So they want to have really good data. All studies should be overseen by what's called an institutional review board, or an IRB. They are an impartial group that reviews all research to make sure that they are being conducted ethically, and that to make sure that they're being conducted as proposed. If an IRB is not mentioned when you're invited to participate in a clinical trial, I'd like to encourage you to consider if it's valid research. And so if they don't offer that information, ask them, who is your IRB? What is their contact information? They should always have that information and be ready and willing to give it to you. If you have any questions or concerns about the ethical conduct of the study that you're participating in, you are more than welcome to, and I would like to encourage you to contact the IRB to get those questions answered. The IRB's information is often given on what's called an informed consent document. And so that document also gives a written outline of the study. It'll tell you why you're being asked to participate. It'll tell you what the procedures are, what the risks and benefits are of participating, and other details. If you're not comfortable with signing it on the day you receive it, that is 100% okay. When I was a clinical research coordinator and I was talking to participants about research, I would always tell them that they're welcome to take the document home and go over it with their family, and I'll call and check in after a couple of days, or they can call me if they have any questions. If you're not offered an informed consent document, and if you're not given time to go home and think about your decision to participate, again, you may want to consider if the research is valid. So the last bullet here says to complete a process of informed consent, because that process includes being given all of the information and being given the time to make an informed decision about whether or not you want to participate. So I also want to mention that not all clinical research involves taking an experimental drug. Some are for an experimental procedure, or some may be using an existing drug in a new way. And also there are certain studies called observational studies, where they're a research study and they can be done in a clinic, but they're not testing a new drug or a new procedure on you. They're just collecting information, or maybe biospecimens like your blood, your urine, saliva. They want to collect that information to understand more about a disease, or to understand more about a population. So if you ever have any questions, if you ever have any opportunities to participate in clinical research, I'm here to encourage you to do so. And if you ever have any questions about participating in clinical research, please engage your family, engage your physicians, get all of your questions answered, and call the IRBs if you feel like you need to. So I quickly want to show you this website, clinicaltrials.gov. It is one way to find clinical research. All trials of investigational products, which means it's a trial of a new drug, any investigational product or procedure has to be on this website. But that means that some observational studies, as I mentioned, the studies where they're collecting information from you, but they're not giving you anything experimental, they may not be registered on this site, but there are some that still are. So if you are interested in learning more about clinical research, if you want to see what's out there, if you want to talk to your physician about a research study, this is a tool to find out more. So you can see here, you could type in a specific condition or disease. This database contains information from all 50 states and 217 countries. So you might want to limit it just to the US, otherwise you'll see a lot of results. But there is an advanced search, so you can even specify things further, like searching in Los Angeles. On this page, when you do search for a study, and if you see something that you may be interested in participating in, there's typically contact information for the study site and the investigators, so you can contact them to learn more about their research. So here are some links to resources that I often turn to. The CDC has a page on breast cancer and a separate page on tobacco. The American Cancer Society has a page on breast cancer. And as I mentioned earlier, both the American Cancer Society and CDC have online smoking cessation programs. So you could use the first part of these websites to find those online. The Susan G. Komen Foundation also has a lot of information about breast cancer and a very detailed breakdown of the current state of research in breast cancer. So I attached here additional infographics or flyers in case you want to print them and share them with any of your friends or family with their links. And this concludes my presentation. I would like to thank the following people and organizations for their support in coordinating this event. Thank you so much, Pastor Rhonda and Celebrate Life Cancer Ministries for allowing me to participate in Breast Cancer Awareness Month with you, and also our USC team and my mentor, and friends and family for their contributions in putting this presentation together. Thank you so much. And here's my contact information. I'll be on the call for the rest of the hour to answer any questions, but you're welcome to contact me at this email address anytime afterward. Thank you so much. So with that, I will stop sharing.
Well, thank you, Ugana. So I don't know if you have a couple of questions. It looks like the questions that were popping up in the chat box actually were answered along the way.
Oh, okay.
So I thought that was pretty good. Is there anyone that still has a question, or maybe you feel like your question wasn't completely answered?
Yes, I see here, know your man's lemons as well. That's important.
Thank you, Ugana. I actually, I was very happy to hear about the prenatal exposure. That's something that has always been in the back of my mind. And you mentioned about those shots that they no longer use since the late 1970s.
Yeah.
And I was actually pretty interested in that topic at one point because I'm a breast cancer survivor myself too. And I remember speaking with an epigenetics doctor, and she was telling me about those specific shots and how when they stopped using those shots in the US in the late 70s, they actually started using them. They stopped using them here, but they took them to Latin American countries.
Wow.
So around like I was born in 1980, and I remember like at some point, my mom mentioned that she had a scare of a potential miscarriage, and they had offered her that. I don't know if she ever needed to take that, but she remembered the name when I told her, and I was like, wow, like, so they were actually using it in Mexico and other Latin American countries. And that usually happens when things get banned in the US, they go to other countries. So I think this is important that we also keep in mind, given that we have a large immigrant community in the US. And I think it's very important that we all keep this in mind to mention this to the doctors.
Yes, that's very important. Thank you for sharing that, Dr. Yasemi. It's DES exposure. It's, even though it's not used in the United States anymore, it's still so the women that had the drug were at increased risk, but also their daughters are being found to have some increased risk of breast cancer, and their sons are having increased risk of testicular cancer. So it's still, we still mention that exposure, even though it's not given, because it's still having generational effects. And I didn't know about it being used in Latin America and other countries. And so that's why it's so important that we're assessing that risk and collecting the information about it so we can serve those women that have been exposed.
Exactly.
Women and men that have been exposed.
Thank you.
Well, there's another comment. Do you see it?
I'm seeing them. I wanted to address an earlier one. Someone asked, Heather asked how to spell the compound in orange and yellow veggies. I'm adding that to the chat now. Carotenoids. And then thank you, Intira. She gave pack years of a definition of pack years. So it's basically saying that you smoke on average 1 pack of cigarettes per, like 20 pack years is saying you smoked on average 1 pack of cigarettes per day. And it's saying pack years because it's also per year because it's saying that you did that for 1 year. So if I actually had a longer duration of smoking, but I smoke more cigarettes per day, I may have something like 35 pack years per per pack years of smoking because I smoked more cigarettes per day over a longer period. So they take an average, but that average is made up of the average number of cigarettes you smoked per day and the length of time that you smoked. So those are both given in your calculations. And I believe that Wikipedia link that Antira gave has that calculation. And so how to find the clinical studies, I gave you the clinicaltrials.org website, but I do also want to, one thing I didn't mention is that clinical studies often are really strict about who they'll let in. And they have to do that because they want to make sure they're getting the cleanest data to evaluate the specific, like their new drug or the specific, items of interest. And so like you see on TV all the time, every time I see like a medical drama where a physician is like, I don't care about the protocol and they do something else, that does not happen in real life. It's actually very strict. And if you do see a doctor that's doing something like that, I would question their medical ethics. And I see Priscilla is laughing and smiling. That's not a good thing if your doctor is willing to break protocol. There are some cases if it's like life-threatening and it's thought that this procedure can save your life, that it can be applied. But otherwise, I really hope that you can engage in conversations with your physicians. They can tell you about how good of a candidate you are for the trial. There are usually some kind of, if it's a medical drug, there's usually some kind of blood test and a physical exam to make sure you're healthy enough to meet the criteria to participate in the trials. So clinicaltrials.gov, or talking to your physician and finding out what's available at your university. Some universities have a website that lists their clinical trials. Some universities and hospitals, have a website that lists their trials and ongoing research. And so you can ask your physician and healthcare professionals for that information. And so do I know of any current research going on? There is a lot. There's a lot of ongoing research. I'm trying to think of, I know that at USC there was one, I think it was on hormone replacement. I saw a flyer about it right before COVID hit, so I'm having trouble remembering it right now. But there are often research studies going on at many institutions at any given time. USC, City of Hope, UCLA, Cedars-Sinai, all the local cancer centers and hospitals, they typically have a lot of research going on, and you can contact people there to get more information. So I see here, as a survivor, is there any information available that has moved beyond the need for smoke-free environments due to secondhand smoke to multi-unit communities and to enforcement of those policies? And yes, Dr. Ghassemi will know better because someone that she works very closely with, Dr. Lourdes Baesconde-Garbanati, does a lot of work in multi-unit housing and smoking and the safeties and precautions in those environments. So I know USC actively has work and research evaluating that through what's called their tobacco center, their T course, which is tobacco center. What is T? Can someone help me with the T course? I should know, but I'm blinking right now, I think, because of the presentation. But USC T course is where you can look. I believe that's even their website. USC T course is what you can look into to get more information on the studies that they're conducting. Yes. So I'll pull up that website so I can give you the exact link.
I can also share with them the information about our upcoming through Dr. Lourdes Baesconde-Garbanati. There will be an upcoming focus group that is actually happening on Tuesday for any people who might be interested. They have been conducting these different types of focus groups for different ethnic groups across Los Angeles. So the upcoming one, it just happens to be for the African American community. However, they have been doing different work groups, like I say, for all the other ethnicities in Los Angeles. I actually participated in one, so I'm very familiar with the content as well. But part of the discussion here, it's this is a research study similar to one of, I believe, Shulanda Mosley was asking in the chat. It's about how people living in apartments in Los Angeles, feel about the smoke-free and vape-free policies, to learn about the situation that tenants are living in apartments that support restrictions on tobacco, marijuana, and electronic cigarettes. And I think this is a very good opportunity for people to get engaged in this discussion, because you don't have to be either in pro or against. Any opinion is valid. It's a focus group, so we want to hear from you, your opinion on these topics. And the people to participate, they need to be 21 years or older, live in an apartment building in the city of Los Angeles, and have access to internet or a phone line. I think that's a pretty good opportunity to collaborate, because at the end of the day, all of these studies help us to improve the policies that we create in the county, as well as in the city, or in the state. So this is a time commitment only of 2 hours for the focus group. People can contact my colleague, Janet Rodriguez. I will write her contact information in the chat as well. And I believe Priscilla were you sending the link, Priscilla?
Okay,
I
good.
just noticed right now. Yeah, but the people will also, if you participate, you receive a gift card. Pretty good opportunity. So you can change the policies in LA.
Yeah.
Thank you. Thank you. The reason why, hello, everybody. The reason why I asked that question is because when you take the time to self-educate and attend platforms such as this to stay educated, it's important that at the end of the day, at the back end of everything is being handled appropriately too.
Yeah.
I literally 9 months ago, just very briefly, left where I lived before because it was a smoking complex to a non-smoking now that I had gone into remission. And on the lease, it literally said a smoke-free complex. And that's what I was looking for. I was sharing with Pastor Rhonda, price range and smoke-free was my priority. And I was assured that, because it's just clearly stated, it's a breach of contract. Well, since March, I've been asking, hey, can you help with this secondhand smoke that's infiltrating my apartment? And in February, I did my mammograms and my ultrasound. I was all clear. This year, I celebrated my 5th year milestone. And then recently, I've been getting sick. And so all of a sudden, I feel the need to go to oncologists, and we've discovered something.
Oh, I see.
And that is difficult when you strategically find a non-smoking, smoke-free community for this very reason. And then when you're here, they're not following through on breach of contract. And then here I find myself in a situation. And so I think it's going to be this right here. I was sharing with Pastor Rhonda has birthed a need to, for me to come forth and advocate at the back end, because you could fight to live and change your health and things like that. But it's going to be important to enforce these policies.
Yes.
When a known complex states and is listed that they're smoke-free, and yet they don't handle the breach of contract.
Yes. And that's the hardest part, really. It's like you're doing everything that you can, but still the behaviors of other people can affect your life. And clearly in this time of coronavirus, we're experiencing that on multiple levels. And so it's always difficult to navigate that situation. I was in a similar situation at one point when I first moved into an apartment. Even though it was smoke-free, every morning I woke up to the smell of smoke. Fortunately, I was in a position where I brought it up to my manager multiple times and he addressed it. And so after a couple more weeks, that wasn't the case anymore. But it's just, it's important to talk about these things. It's important to get, people on your side, your manager, whatever the case may be. But it's also frustrating because you're in this environment, you may not have the flexibility to move, or you may not have the time to find another apartment. And even if you decide like, okay, I can't live like this anymore, there's still the concerns about, is this going to be considered you breaching your lease if you move out because of the smoking habit? So there are some tenants' rights groups. I don't know any off the top of my head, but I'll, if you could personally send me your email address in a private chat, I'll look up some tenants' rights groups so that you can have that information in case you're ever faced with it again, or in case it's something you want to pursue with your tenant, because they should have responded to your request to address that.
Yeah. So again, just I want to get involved. This is what has led me to. In 2 weeks, I'll know if there's cancer there or not.
Yeah,
But
God forbid.
God forbid. But the thing about it is their bottom line was they already knew about these tenants here before they leased the apartment.
Mm-hmm.
So with me emphasizing, this is why when they say, why did you choose our community? We're glad to have you. I stated the 2 top priorities, and you knowingly placed me with known smokers.
Yeah.
And so that in itself is, that's very disheartening. And I want to be involved. For some reason, I'm being called to the forefront to get involved in this area because people's lives are greater than the bottom line.
Yes.
And especially if you're stated as a known smoke-free unit within the county. So, yeah, so that was the reason for me proposing my question.
Yes. I'd like to encourage you to, if you're able to participate in the groups, contact Yana Rodriguez. I know that is something ongoing research at USC. And so that is one way that your voice can be heard. So thank you so much for sharing your story. And, let's all continue to advocate for ourselves, for our safety, for our health in every way that we can.
Thank you.
So I have one other person that I would like to share some information about a upcoming focus group and possibly another program. Dr. Sharon Cobb, are you there?
Hi, Pastor Rhonda. Hi, this was a wonderful work informational session tonight and very informative. Thank you all so much. Do you want me to talk a little bit further on so Pastor Rhonda and I are partnering as well as with other community leaders in order to develop a cancer survivor and caregiver leadership workshop training for various clergy wives and widows. So with that, we're first starting off with a focus group of cancer survivors and caregivers. And this will take place over Zoom, very private, as well as just filling out a demographic information. So we're looking for just all cancer survivors and caregivers who meet the screening criteria. So if you have any questions or if you know someone who may be interested, there is no geographical barriers. You could just kindly let Pastor Rhonda or myself know. You could just message me in the chat if anything. So thank you again for tonight. It was really, really, really a blessing. Thank you.
Now, is there also a focus group that we're looking for?
Yes, that's the focus group. And so
okay.
So the focus group will take place online over Zoom. So we do have the information in which, you will be able to fill out the consent form, learn more about your participation in the focus group. And if you have any questions, just feel free to let me know. It's an easy consent form. It's over SurveyMonkey, so you'll be able to fill it out. And from there can give more information. So we're looking to schedule this within the next month, and there is compensation, a nice compensation. So please feel free to let us know if you or anyone you know would be interested in just sharing their perspectives. Thank you.
Thank you. So we probably have time for just one more question. If there's something that's burning on someone's heart.
Pastor Rhonda, if there are no more questions, I believe Rosa Barahona mentioned something and maybe she wants to say it aloud so the group can hear.
Okay. Rosa?
Hi, everyone. I just put in the chat a comment that if anyone is interested in tobacco control, the state of California has funded several different statewide programs to do some leadership trainings, which will take place next month. So we actually have set out an application that if anyone is interested in learning how to become advocates and learn other leadership skills, please send me an email and I'll be more than happy to share the application with you so you can take part on this cohort. We're actually doing this leadership trainings all throughout the state of California, and next month is here in Southern California, but we're also doing some in Central and Northern California. So just wanted to share that with you.
Awesome. Thank you, Rosa. All right. So Celebrate Life has one last announcement, and it is this Sunday. at 4 o'clock in the evening, we will be having our virtual tea. And it's a stay-at-home tea. Wear your pearls, your fascinator, your hat, your gloves, set your tea table, and join us as we celebrate breast cancer awareness. And we will actually have someone from Bliss Tea Pantry, I think. However, the main name is Bliss. And she will be here to talk about various types of teas and the important and the reasons why people do tea parties. Okay, so that's all we have. And you can reach Celebrate Life at celebratelife.cm.org, and you will be able to find the registration information for participating. Today has been a wonderful day. I want to thank Ugana. I would like to thank Dr. Jasimi and Miss Priscilla and Miss Sierra, who did some background work from Xavier University. She's an intern with Celebrate Life Cancer Ministry. We really want to thank all of you for helping us to pull this together and have a wonderful evening. And thank you to all of our guests. You didn't have to come on after all your Zoom meetings that you had today, but you did. And we are very grateful. And we look forward to seeing you soon.